Thank you. I want to thank the IOM for inviting me to participate in this really important discussion. Dr. Wisdom and Dr. Nielsen really gave us a great groundwork in where the discussion should go today, talking about what disparities are, talking about health equity and digital health, and then talking about access, patient portals, and health literacy, which we'll get into more today. And I must say, this is not the talk that I initially planned to give for this presentation, but this is the talk that I'm supposed to give. And then after hearing Wendy this morning, I am assured that this is the talk that I'm supposed to give. So the question is, why do we think digital strategies will make a difference in addressing health disparities? There are so many interventions that have been developed over the years, and yet health disparities persist in minority communities across the country. And how is this different from the behavioral interventions that we've done that are rooted and grounded in theory? How is this different? Well, first, unlike other innovations in healthcare that go through traditional channels of the health system, where they're received by more advantaged populations and more well-resourced people first, this is an opportunity for digital to first be seen in minority and underserved communities, and that's because mobile is different. Minorities are early adopters of technology, and Wendy already talked about the digital divide. Early in the days of the internet, the lack of access to broadband, the ability to afford a computer, those were some in where you lived and whether you had service in your community. That's still an issue. And the issue of cost. And minority populations began to experience what we started talking about as the digital divide. Everyone was talking about the digital divide. But with the advent of mobile and the use of smartphones, minority populations have bypassed whites, as was said already today, in the use of mobile technology. And you see this from the Pew data, that from 2000 to 2013, there was a significant change between the difference between African Americans' use and white use of being online, and then when it came to smartphones, we've overtaken them. Minority populations have overtaken them. But in addition, minorities are leaders in the online community. Adoption of mobile technology really opened doors of access to information and created platforms for disenfranchised communities all over the world. We've seen this in many uprisings, and in the United States, this is particularly true for minority populations. For the sake of time, I'm going to highlight African Americans because that's where I do my work. But African Americans are key influencers in the digital space. According to 2013 Nielsen report, 73% of whites and 67% of Hispanics believe that African Americans influence mainstream culture. And in this age of the Internet of Things, African Americans spend more than twice the time per person on web hosting sites as the total consumer market. So what exactly does that mean? That means that they're more likely to have their own personal websites. So what you're seeing is that in this case, minorities are not just consumers, they're actually producers of information. And we've seen that translate into an ability to influence the content of discussion in mainstream media. I was literally out of the country when Ferguson, Missouri happened. And I learned all about it and followed it on Twitter. My husband's not as social media savvy as I am, and he was following it on the news, and he was leaps and bounds behind where I was in my information and my knowledge. He said, well, I'm looking on the news channel and it says, I was like, no, look here. And it completely changed his mind. He said, wait a minute. what I'm seeing here is, I'm like, this is what's happening on the ground. And then the question became, well, how do I filter this? How do I understand what's going on? I was like, and so we went through a training process of how you filter the reliability of information online right there. But what happened in Ferguson is now part of history. But we learned about these, it became international attention. And it brought attention to a case of social injustice that wouldn't have previously been possible. However, we really have not been able to translate this into the use of technology to drive health discussions. But really, there's a clear interest in this. Minorities are really interested in using digital for health. We recently did a study, and we asked African American parents in an urban clinic about their internet and mobile technology use. Almost 90% of the parents said, without a doubt, yes, I want health information online, I want it by text, I want it mobile, I want by text message, I want that information. And that was our study. And other studies have shown in pediatric populations, particularly, over 80% of parents had a smartphone in urban pediatric clinics in New York City. And over 50% of them use that smartphone as their primary way of getting online. So not only are they there, not only are they making a difference, but they're actually really interested in having a health discussion. So clearly, there's a great opportunity for use of digital strategies to address health disparities. So why hasn't there been any real progress in this area? Well, I think there's a disconnect. Much of digital strategy comes from here. And for people who know Silicon Valley, this is a famous exit into Silicon Valley. But many of the people who suffer from health disparities come from here. And this has resulted in a disconnect between where digital strategies are developed and where the need is. So the motivation for the development of digital strategies is primarily driven by financial gain rather than improving health outcomes. As a result, there's very little motivation to commit to the sometimes lengthy process that Wendy talks about of developing an evidence base to determine which tools actually move the needle. And without evidence, providers are not going to adopt them. I work in an underserved population. My patients and I've been there for decades, and my patients and families have very limited resources. I am not going to suggest to them a technology that has no evidence base that I don't know is going to work. Because that's taking food off of their table, clothes off their kids' backs, and other resources that and medicine out of their mouths that I know works. So when we talk about how are we going to move the needle for providers, we need evidence. Wendy says, I'm preaching to the choir. This is a quote that's been used a lot in reference to the Affordable Care Act. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And when I was preparing for this presentation, I went back and I reviewed what some of the other workshops that were sponsored by the committee covered in talking about approaches to addressing health disparities. And I was really moved and impressed by a cautionary tale by Dr. Francesca Paoletta on building a social movement for health equity. And everyone can agree about the importance of addressing health disparities. And what that does is it makes what she described as a bit of a consensus movement. And so what does that mean? That means that there's no common enemy to rally around. Ferguson gave us a common enemy to rally around. Everyone can agree about this. So that not having a common enemy means that there's no necessary call to action from all the multiple stakeholders that need to come together and come into play. And the example that she gave was the movement to address climate change, which some have described as becoming more of a lifestyle movement. So you have Prius drivers and you have Tesla drivers now, and you have recycling and you have composting, but you don't have the policy change that needs and infrastructure change that needs to happen to really move to climate change. And the current drive in digital health is really very heavily market-driven. It's a marketing campaign for the latest gadget without real regard for the evidence of improvement in health outcomes. And to avoid digital health strategies becoming the Tesla of healthcare, they must be grounded in non-digital infrastructure, organization, and policy differences, like Dr. Wilson talked about earlier. Thank you. The power of social media that is led by and activated by the minority community successfully drew attention to the tragedy in Ferguson, and it created a moment that will be marked in history. However, they had to turn that moment into a movement. And what you saw is a connection to grassroots efforts, organizations, infrastructure that led to something that was sustainable. And now you see a drive for policy, and we hear a discussion of police officers wearing body cameras that are going to help reduce police brutality in our country. Rosa Parks wasn't just a seamstress who sat down on the bus and decided she didn't want to get up. She was part of a strategic grassroots movement connected to a plan to influence policy and make changes. And we have an opportunity that's really unique to utilize digital strategy to address health disparities. And to do this, we need to leverage the trusted leadership of online minority communities to draw attention to the injustice of health inequities, to create a call to action. I partnered, and to do that, we have to become learners in a community where we already have leaders. As part of my work, I partnered with a well-known blogger in the online community just to add to her previously focused lifestyle website. And all I did was add a blog once a month to talk about health, to give references that were appropriate and give people resources that they could go to that were reliable online. Once a month for 6 months. And that blog went from, and she already had an audience. She didn't need me. She already had a large audience, but there was a passion and an understanding about the importance of the platform and the importance to create a health dialogue. And she had multiple bloggers who participate. So it's a multiple blogger site. So it's not just one voice, it's multiple voices contributing to a dialogue. Just in 6 months, we were able to transform that blog, not trying to, from a lifestyle blog to a blog that provided reliable, important health information to moms of color about their children. And we saw that transformation, and that transformation continued long after I was contributing to the blog, and we looked at it and we did data analytics to see that we had changed the course of the conversation and what references they were using. And these are some of the things that we have to think about. Where are communities online? Who are the leaders in the online community? And how can we work with them and connect with them to make sure that the information that people are receiving is the right information? And we have to partner with minority developers. They are part of the community that's most in need. and they understand the burden of health disparities firsthand. They've got a family member, they've got a friend, they've got a grandparent, a cousin, someone, a care worker who understands and knows the challenges of health disparities firsthand and can be passionate about it. And then we have to link that call to action to offline organizations and systems, churches, community organizations that will push to drive for better access to health care through the Affordable Care Act. We've seen the increase in coverage in particular communities like the Hispanic community in states where there is coverage, and the difference in what we see of people not getting coverage in states where there is not. And we need to push health systems to implement meaningful use in a real way and not use it as a checkbox to say, oh, I got that so I can get the funds. It needs to be patient-centered and patient-focused, and we need to encourage patients and communities to drive and push for that and fight for that. And without these tangible, sustainable movements for change, we'll just be wearing more stylish Google glasses and quantifying ourselves while people continue to prematurely die all around us. Thank you.